All right, everybody, welcome to our next session. We'd like to welcome ER Express. ER Express developed a solution specifically around digital wait queues for patients that are coming into the care facility. It enables patients to securely get in line from their own device while they wait in their car and save a spot in line without coming indoors and then being paged and brought in when it's their turn. It really enables clinical staff to influence patient arrival times and throttle how many patients are in the waiting room at the same time, especially during COVID-19 when we're trying to minimize cross-contamination of patients in waiting rooms. This is a great way to keep patients as separate as possible while they're in the triage process. We'd like to welcome Michael Cutter from ER Express. And Michael, take it away.
Great, thank you. Thank you very much, everybody. I'm Michael Cutter. The company is ER Express. We're very happy to be part of this and to share with you our COVID-19 rapid response package. And as in the introduction, it is patient queuing solutions, doing our part to help flatten the curve. Specifically, what we're doing is enabling or promoting social distancing, helping you protect your staff and patients from the spread of the virus. This is specifically designed for on-demand care, urgent care facilities, walk-in facilities, emergency departments. And we're really doing this in two ways to cover 100% of your daily patient volume. Let's start first with online, and that is the ability for a patient to save their spot in line online in advance of their arrival for a predetermined time and do more of their waiting at home. So here's where we're truly creating the virtual waiting room. There are features that give you some control in terms of flattening the arrival curves as well so that you can decompress the waiting room. The other is designed for your walk-in patients. These are going to be your patients that did not make an advance reservation and do their waiting at home, but rather showed up as a walk-in patient does today. And they're able to get in line as well. And they can do that via text message, even wait from their car. And we have some clients that are asking 100% of their patients to wait in the car until they receive a text that we're ready to treat you now. So let's start with the online piece. This lives on your website. This is where we're creating the virtual waiting room and allowing patients to do the majority of their waiting at home or wherever they're comfortable. And they're simply able to see your facilities and in real time, a first available time that they can check in and hold that spot in line and again do their waiting from home. The other, turning to your walk-in patients that just show up without an online reservation, they are entering the queue and getting an estimated treatment time upon arrival as part of this process using their own mobile device. So they'll receive text updates about their visit and when you're ready for them. And there is no kiosk or physical equipment that they need to touch. So a little more on that, just to give you an example of how how this is communicated to patients upon arrival. And this can be even done right there in the parking lot, is to provide them with a keyword and a short and a number to text to. And this is an example of a signage that's being provided or even put onto a card and handed to patients when they pull up, and asking them that they can remain in their car if they would like. When they send in that text, they'll immediately get a link which they can tap on, and it's a short form. First thing they'll do is just indicate whether they already made an online reservation, which just simply says, okay, this patient has arrived. Or if they're a walk-in patient, they don't have a reservation, they fill out a very short form and they do their waiting. Now, they'll receive a confirmation of a projected treatment time by text. And then your staff has the ability to trigger updates to the patients. And so that can include any sort of changes to their estimated treatment time, as well as the notification that we're ready to treat you now. Quick screenshot here shows you the control panel. Your staff in a standalone environment has a view of every patient in line and where that patient is, whether they're waiting from home or whether they've arrived. And they're simply just moving those patients along in terms of the workflow when they're ready to treat by sliding them over. That in a nutshell is digital queuing for patients. We do have additional features that we can bring to the table as well, designed to help you collect additional information if you're interested. So adding pre-screening questions to the online or walk-in sign-in process, or assisting patients with the decision of where to seek care if you want to help guide them to your telehealth programs or primary care scheduling. We can do that as part of the process as well. And then lastly, bringing chat bots that assist with pre-screening as well to educate patients and also provide more information for your staff. So in terms of delivery, we've got a free 90-day, no fee, all fees waived. No obligation to sign a contract with us. We're just doing our part to take some stress off of the healthcare system in this country, and we can do all of our delivery remotely. That's everything you'll need for the online reservations to work on your website, as well as staff training. And we're looking at a 10 to 15 day go live as soon as we hear from you and you're ready to go. That's it. I know I can't take questions. If we've got extra time here and you're able to see my screen, I can pull up some live client examples just to see what different clients are doing. Here's a client that has implemented the chat bot, and on the page where it is promoting online check-in. And online check-in at another client here, Cox Health Save My Spot. And within the page where patients can save their spot, you'll see we've added information about COVID-19 as well as promoting virtual visits. To save my spot, if you've never seen or used something like this yourself, it's a simple online form. It's mobile friendly as well. Patients have the ability to look at other reservation times that you've made available. This is where staff can, in real time, make, our system can make adjustments on the fly, since we have a read of 100% of your patient census at any given time. We'll know if 10 patients just showed up, and we'll be able to push out the next available time in real time on your website. But they're entering the chief complaint. We've got additional features in here that allow you to have flags set up when a patient submits terms or keywords that you're interested in drawing your staff's attention to. And then their contact information and some light demographics. So very low friction by design. And then interestingly, I'll probably end with this one, is a client that is asking for 100% of their urgent care patients to wait in the car. So we can see online check-in on the website. And as we scroll down, they have added now this bold red text here that promotes our walk-in patient queuing by text, where when they show up, they're asking everybody to text that keyword, CRMC, which stands for Coleman Regional Medical Center, Urgent Care, and please stay in your car. So that is a wrap, and we're most interested in helping any health system that's interested in rapidly deploying this system. Thanks a lot.
Thanks, Michael. Great presentation. For folks that are following the chat on this side, Sahil Patel, the CEO of ER Express, posted his contact information. You're welcome to reach out to him directly for any follow-up interest or questions.